Welcome to another Connection here on TKO8 Television. Dennis King, thanks for joining us this week on our Connection show. Each Monday we have different organizations and individuals from those organizations come in to talk about what should be important to you, what's going on around our viewing area. And we cover several counties, actually, about 6 counties here in the Harrison area. And we hopefully do give you information that maybe sometimes it kind of slips by you, or perhaps you don't even know about these organizations, and we want to get the word out there. And we do appreciate all of them contacting us here and coming into the show each week. Stay with us. Be back in a moment. We're going to talk about something that's not very pleasant to people. It's the flu season, but there's a way to keep it from being quite so bad. We'll be back in a moment.
Go ahead, say it. It's a dirty job. Somebody's got to do it. That somebody's me. I'm Bruce Lovins, better known as Little Bruce from the Roof, at your service.
That was over 20 years ago. The hat has changed, but we still provide the same great service. We not only clean chimneys, we do dryer vents, gutters, and handyman jobs.
Little Bruce on the Roof Chimney Services. Call 870-688-3389 and let Bruce come to you. That's Little Bruce on the Roof. Call 870-688-3389.
Call me.
A hint of autumn is in the air, and the staff at Sisters Flower and Gift Shop invite you to stop in and browse their selection of new fall and holiday gift ideas. Check out their new line of organic grow kits, including basil, thyme, sage, rosemary, and many more. For you Razorback fans, Sisters has a large assortment of mugs, trays, banners, clothing items, and accessories. From fall and holiday floral arrangements, unique centerpieces, colorful wall decor, or exquisite serving pieces, Sisters has just the right item for any occasion. Sisters Flower and Gift Shop. We are so much more than flowers.
Back on Connection here on TKO8 Television. Our first guest in the studio today is from the Boone County Health Unit, and she tries to come in every year, and I call her up and say it's about that time. It's almost flu season. Tammy McCutcheon, thank you for coming in,
Thank
Tammy.
you for having
I know
me.
you're a busy person always, but we do appreciate it. Not something we like to talk about because nobody wants to get the flu.
Exactly.
But unfortunately, we go through it every year, don't we?
Yes, we do.
Who should get a flu shot? I guess a lot of people don't really know. Should everybody?
Honestly, anyone 6 months of age and older. We encourage 65-year-old and older, pregnant women, people with chronic illnesses such as diabetes, heart disease, lung disease, cancer are a group that needs that for sure. Another group is caregivers and private medical, yes.
Yeah,
I'm sorry,
staff.
healthcare providers, yes.
Yeah, obviously they're around.
Yes, because they build up their immunity to the flu, and then that protects the people that they're taking care of.
Right. So, actually, for those people out there, the flu shot itself, why should you get a flu shot? What's it do for you?
The reason to get a flu shot is to protect you and yourself and the people that are around you. The flu is a very serious illness. Thousands of people in Arkansas are hospitalized yearly, and then there are some deaths that occur. Getting the flu shot boosts your immunity, and it's the best protection that you can get for you and the people that you are around that are vulnerable to health conditions.
So it really, in fact, you're not only helping yourself, but you're helping your friends, your family members, your working cohorts, or whatever.
Exactly.
By getting the flu
Yes,
shot.
exactly.
So it's a preventive measure. Flu season, when do you get a flu shot? When's this?
Usually the flu season's anytime between October and March is what CDC recommends is the flu season that you should get the flu vaccine.
Okay, so just remember when we start going into fall, we're officially into fall right now. When you go into fall, you probably should go get a flu shot somewhere. Flu vaccines, there's been a lot of controversy over, is a flu vaccine safe? Do I want to give it to my child? Do I want to take it? Let's talk a little bit about that.
The flu vaccine is safe. There is myths out there that you can get the flu from the vaccine. That is a myth. A lot of times what usually happens is someone will get the flu vaccine, or actually they're around the flu and get the virus, and then they get the flu vaccine. Of course, it takes 2 weeks for the flu vaccine to take effect.
Okay.
So they're thinking, well, I got the vaccine, now I'm sick, so it must have been the vaccine, but that is a myth.
Okay. Well,
It's very safe.
You hear that out there in the public, in the media, even sometimes. Yeah, they get hung up on the fact that, well, You know, you could get a flu shot, and you know, you could get real sick from a flu shot. I never had that happen to myself, and I've taken them for several years now.
Some of the side effects, you know, from the flu vaccine would be a sore arm at the injection site or a low-grade fever, but that's usually over in 1 or 2 days. So.
We don't have to get into the details of it, but I know the professionals in the medical profession nationwide, nationally, that I guess is maybe CDC, but they determine each year kind of what hopefully they can pick up on the strain.
Yes, they determine the strain and then try to match the flu vaccine to that. This year, we've not heard that it's changed much, so it is basically the same vaccine as last year.
Okay. Now, if I get a flu shot, am I guaranteed not to get the flu?
The flu shot is not guaranteed 100%,
Right.
but it is our single most effective prevention method that we have right now. The flu vaccine against the flu. Mm-hmm.
So I'm assuming, like, if I get a flu shot, I might the possibility of me getting the flu is still there. But if you get the flu and you've had the flu vaccine, it should make it a little more moderate.
A little bit more moderate, yes. Not as much as if it was just a full blown case of the flu without the vaccine. Yes, because your body has built up some immunity to that.
There, you know, the thing about it is, if you have a job or if you're working with the public, what are some things that we can do, and then maybe even help our children do to maybe prevent, or at least try to prevent?
Yeah, good hand washing is going to be your most effective means. You know, don't to touch your nose, your mouth, your eyes. I know a lot of times that's hard to do. You think, oh, you know, we automatically go to our eyes if something itches, and you may be passing the germs. Stay away from sick people as much as you can. If you feel bad, you stay home, and of course get the flu shot.
Right. Don't bite your fingernails.
No, don't bite your fingernails.
Don't be biting your fingernails, okay? You know, through the years past, since I moved back here, I know there's been a few seasons where the flu has been really a lot worse than others. So it kind of goes in cycles, doesn't it?
It does. It does. I don't have the number of how many cases there were last year, but it doesn't seem that they were any more than the year before.
Right.
So, you
quite
know,
mild, if I remember.
People getting the flu vaccine is helping the most.
Yeah. You know, public awareness is a big thing in anything we do these days, and of course, electronic media, television, and social media has helped a lot get the word out. And some people that maybe don't keep up with media all that much are having a better chance of at least hearing about it, and we talk about it more, I think, than what we used to.
Yeah, and of course everybody has a Facebook page now, and the health department actually has a Facebook page, and we try to put information about the flu season and the schools that we'll be going to and things like that on there. Yeah. And you also can go to cdc.gov for more information about the flu vaccine.
Okay, all right. So what if, I mean, I've had headaches, and I've get a low-grade fever. What are some of the symptoms of the flu? I mean, how would you know that you think you might have the flu?
Well, the flu is just a quick onset. You could go to school or work and feel fine, and then it hits you, and then you're ready to go home and get in bed. You're going to have fever, chills, possibly sore throat, headaches, body aches, fatigue, coughing, sneezing. Sometimes diarrhea and vomiting, but it's usually just the other before that. That's usually a virus with that.
So it can slip up on you pretty quick.
Yes.
You might feel great one day or even that morning, and then by afternoon you're not feeling so good. So it could be. As far as the flu itself, let's say that I think I've got the flu. Is it wise for me to go to a physician, and is there much they can do about the flu? Does it have to run the cycle?
Well, they do have some antivirals, the physicians do, that they will give you for the flu. But yeah, definitely stay home, stay away from people that are vulnerable to the, immune systems that are low and things like that, because it is highly contagious.
Very contagious. And I would say, is it much more contagious anytime, or is it at the early stages? How do they? I'm
not for sure about that.
Okay, I didn't know if
I would say
probably anytime you have it until you get rid of the virus. Tammy, I know in past years, of course, the Boone County Health Unit is right here in Harrison, just out past the college out there. But you've done programs for schools, and then you've had your mass clinic. Let's talk a little bit about how you do that with the schools and when.
Our first school clinic will be the 11th, and I believe we'll be going to Omaha, if I'm correct. And then scattered throughout the rest of the month of October, we go to all the schools, all the elementaries of Harrison, and then, of course, Bergman, Valley, Alpena, all of them, Lead Hill, Omaha. There's forms that the parent will be seeing come home with their child. If they'll fill that information out and get that back with their student, then we'll be able to give them a flu shot that day. We have to have their signature to be able to get that flu shot.
Now you said you go to all the elementary schools. Do you just go to the elementary schools?
We go to high schools. Yeah, like Bergman and Valley are big. We just do one whole day with those schools. The other ones we go to Harrison High School, and then middle school a different day, junior high, and then the elementaries.
Okay, yeah. So all the students in the schools, if signed off by the parents or guardian, will have an opportunity for a free vaccine.
And also the teachers and any of the staff that choose to get the vaccine, we'll do that for them at that school that day.
Is that something, I guess, where's the money come from? Is it the taxpayers' money, or is it, since it's free, who?
Well, we do ask that they put, if they have any kind of insurance or Medicaid, or to put that on the form, and it's billed through Little Rock.
Okay.
Yes.
So if you do have insurance, or if you're on, well, anymore under the Obamacare, everybody's supposed to have something. So if you're a Medicare recipient, or Medicaid, if you're on Medicaid, or if you have your own private or business insurance from whatever, you need to tell them, because then they're authorized, and the insurance companies pay for it. They're authorized to.
And if they don't have any type of insurance or anything, we do that at the schools just for free.
Okay. So
we don't charge at the schools. Now at Mass Flu Clinic on the 28th of October, we do the same thing. We ask that you bring your Medicaid, Medicare, or private insurance. If you don't have any of those sources, it's free to you that day.
Okay.
After the Mass, if you choose to come into the health unit, there's a $30 charge if you don't have any of the insurances.
Okay. So the Mass clinic this year for I guess all of Boone County, is that right?
Yes. Mm-hmm. We've actually had some people from out of state stop by, so anybody really, but it is a Boone County Mass. Mm-hmm.
Okay. So the Mass Clinic, put this on your calendar. It's very important. I forgot it last year, so I can tell you, write it on your calendar, put it in your BlackBerry or phone or whatever. October 28th, and I'm assuming, is that a Friday?
Yes, the last Friday of October.
Okay. So October 28th, the last Friday of October, from 8 a.m. in the morning till 5:30 p.m. at
the Eagle Heights Baptist Church.
Eagle Heights, okay. Same place you've had it in the past, okay. And you can't miss it. If you don't know where Eagle Heights, you get close to it, and you'll see a lot of cars. They'll have volunteers parking cars and helping people get in and out. It's a big deal. And if you can go to this Mass Clinic, it helps a lot, because again, they have all their staff there that day. And again, take your insurance card, whatever you may have. If you don't have any coverage by anything or anyone or any place, then they won't charge you for it. But if you do have, that way they can bill the carrier and so forth. And so if you miss the clinic, can you still go to you said?
Yes, you can still come to the health department.
And usually you have vaccine for a while.
Yes. Yeah, we'll have vaccine for a while. No appointment required. Just walk in, and we'll serve you just as quick as we can. Usually it's pretty quick. And the Mass Flu Clinic is just really the easiest and quickest. We had some people last year said by the time they got parked and in there and out, it was like 10 minutes. So that was good. We were glad that was the way it was going.
Yeah, it's what a great service, again, by the Boone County Health Unit here, and Tammy McCutcheon and all their staff out there. They do a great job. If you can make that Mass Clinic, please write that on your calendar, because that's the quickest way, the easiest way. Again, that's Friday, October 28th. It'll be from 8 a.m. in the morning till 5:30 p.m. in the afternoon. They'll be going nonstop during that time frame. And take your insurance card, will you, if you go over there, so that they can take care of the paperwork. And it won't take very long. They have a lot of stations, so they move them through very quickly.
Yes.
Tammy, thank you so much. I appreciate you coming in, and as always, it's a very important thing, part of our health, obviously. The flu season's coming up, and don't forget the Mass Flu Clinic. If you miss it, go out to the health unit and get it, or go to your physician. And then a lot of the pharmacies are also doing vaccines too, I know.
Yes,
so
that's the main thing, just to get the flu vaccine.
one way or the other.
Anywhere, we don't care, just get the flu vaccine.
Tammy, thank you so much. Tammy McCutcheon with us today talking about the upcoming flu season. Stay with us. Be back in a moment. We're going to talk with a young lady about lots of different pets and situations we have right here in Boone County.
We all need the help of a pharmacy from time to time. Sullivan Pharmacy would like to thank all their customers for supporting them as an independent local pharmacy. When you trade with an independent pharmacy, you deal with an owner that supports the local economy and charities. Visit Sullivan Pharmacy for any of your over-the-counter or prescription needs. It's important to keep helping those that help the community. Sullivan Pharmacy, 731 Main Street, Harrison, serving this area since 1965.
Many things have changed over the years, and so has auto body repair. Even though Ozark Auto Body has been in business for over 30 years, they continue to change with the times. They believe protecting the environment is important and have done so by using environmentally friendly waterborne paint from PPG. This aligns with the technology used by original manufacturers and gives you a lifetime limited warranty. Quality PPG waterborne paint, ASC certified personnel, plus 24-hour towing service. Ozark Auto Body in Harrison, always taking pride in excellence. Back on Connection here on TKO8 Television. Dennis King, thanks for joining us on the show today. We hope you enjoyed the first half of our show. We talked about the flu season, and it is coming up, as Tammy McCutcheon was talking to you from the Boone County Health Unit. Something on the lighter side, we're going to talk about pets, and we have Michelle Roust with us today from the Ozark Humane Society. Thanks, Michelle, for coming in on a busy day for you, I know.
That's okay.
Nature's Wonder's always busy, so we got to plug it.
Yeah, absolutely, but it's always worth it to take a break and talk about dogs and cats. It's my passion, right along next to health food.
Yes, I know you do like. Maybe just for the viewing audience, just briefly, some people may know about the Ozark Humane Society and their shelter and the other entities that they have. Could maybe just talk a little bit about the shelter and kind of how many dogs and cats you roughly have to keep out there? And it's a big problem, I know.
It is. There's just so many, not just here in Harrison and Boone County, but homeless animals is a huge issue, and it's thanks to nonprofit organizations like Ozark Humane Society and volunteers and donors who keep those animals or help keep those animals off the streets, out of the cold, that sort of thing, and get them the vetting they need and help find them new homes. So, but here we have, thankfully, the Ozark Humane Society, which is a nonprofit organization, basically ran by a board of directors, and we have a small staff of our shelter manager who is actually at the shelter, and then a small staff there, and then a manager and a small staff at the Cause for Paws thrift store, which is our main source of income. The Cause for Paws thrift store, all the money that's raised there from donations and from people shopping there goes directly to the animals. So that's a huge thing, and we're grateful for that. And at the shelter itself, it's kind of a daily challenge for all of them who are out there. We're so thankful for the staff that is out there. At any given time, there's somewhere around 80 to 100 animals there, and that's at about 100 animals is about max capacity that it can hold at that current location. And but they do such a phenomenal job working with what they've got out there to work with, and getting the animals the care they need, shelter, food, vetting, everything like that.
You know, you see, and it just kills me. I'm a soft-hearted kind of person. I don't even like to hit a squirrel when it runs out in front of me. As a matter of fact, at one time in my life, I had a little accident trying to miss a squirrel, and the state trooper, I'll never forget, said, "You know, Mr. King, you really should have probably went ahead and hit that squirrel." I said, "I just couldn't do it." But a few $1,000s later, I got my automobile fixed, and I felt really better because I didn't hit the squirrel. But nevertheless, you know, there are a lot of inhumane people, unfortunately, in society today that really don't think about animals as being someone that we should take care of as well as adults and people. But they really don't. They don't need to be abused, and they need to be taken care of. And there's a lot of people out there that would like to have an animal, and some go and spend hundreds and hundreds and thousands of dollars for registered dogs, and particularly dogs, or go get some hybrid cat or something, when really you can go to a humane society like we have here and get a great pet, and sometimes even better.
Well, I always say rescue is my favorite breed.
Yeah.
I think that's super important to me. I think that rescued pets. I only have rescued pets, so I don't have a lot to compare
You have
to.
pets? I can't imagine.
I know, right? I know me. I'm not even an animal person, but I just think they're just the best, and they're very appreciative, and they can really be such a great addition to your family and to your home.
Yeah. Michelle, we were talking about the shelter itself, and you were mentioning some staff, but volunteers are very important, I know, to your organization.
Yes, we're only able to support a very small staff, so volunteers are essential to keep the day-to-day going, both at the shelter itself, with walking dogs, socializing them, helping with some cleaning and minor repairs, that sort of thing, and then at the thrift store, unpacking donations, sorting them, putting them out on display,
yes.
Running transactions. I mean, it's just they're such an essential part of the whole function of the shelter.
Yeah.
Yes, we always need volunteers, and we're thankful for the great volunteers that we do have.
Right. You probably don't know. You may not know. I don't put you on the spot, but as far as the animals, you said sometimes roughly 100 dogs and cats out at the shelter. Where do you get are these people find them and bring them out there? Is it did people pick them up on the side of the road? I'm sure kind of everything, right?
A little bit of everything. We also take in the city animal control dogs in a lot of cases. So we get a fair amount of dogs from that. And also, like you said, people who have found a dog, had a dog dumped on them and weren't able to keep it or something like that, and provided we're not full, which is another important thing to understand. It's hard for people to understand when we're full because we want to take them all.
Sure.
But if we're full, we are not able to give them the proper care, the proper shelter. So that's a really, really tough spot to be in. But we do our best to take all the ones that we can, and that's where a lot of them come from, is people have come across them in one way or another and just aren't able to keep them themselves. And so that's how they end up at the Humane Society.
Wow. I think if I recall, maybe, and correct me if I'm wrong here, there seems like there are some states, particularly maybe in the Northeast, if I recall, that they have very strict laws. And if you have a dog or a cat, you have to have them registered. You have to have a license for them. You have to show that they've been vaccinated annually and that they've been spayed or neutered, and so you don't find the Humane Society type operations a lot of places in the Northeast. Is there opportunities where we actually are able to move some pets to areas where their restrictions are so heavy?
Yes, you can. In fact, you're absolutely right. The South is a very concentrated area where this is a problem, even more so than other places.
Yes.
And we don't have a strict of animal cruelty laws, different humane type laws associated with animals, and maybe too that there's just there is more of just there needs to get to the word out, the understanding. That's the word I'm looking for of the problem that it is, and education. But yes, you can find a lot of shelters in the South have sister shelters elsewhere around the country, where when they have an opening, you can send. We've done that a couple of times actually with a shelter in Colorado. Been able to take some animals there, and that's a really good situation when that can happen.
Yeah, when they're actually looking for animals to fill the needs of the people in that area. That's fantastic.
It's amazing because a lot of times that's just not the case in this area.
Wow. Let's see. I want to talk about a couple other things, and then we're going to talk about your big event coming up here. I know you're looking real close and got your fingers crossed that maybe someday in the near future that you'll have a new, bigger, better location for the shelter.
That's correct, yes. So it's our current facility has long ago reached its potential.
Yes.
It has been remodeled and redone and patched and everything to just beyond what it's even, it's just beyond its potential. We really would love to have a new location and a new facility. We've got a building committee now that's meeting every couple of weeks, working on reaching out to the community, looking for potential locations, starting to work on fundraising, just kind of getting headed in that direction. So really just we're very much in need of the actual location itself, but also just an awareness in the community of if you don't think that it's necessary, you just drive out there and look at the current shelter. They're doing the absolute best with what they can each day with that current location, but it's very necessary to have a new facility. So we're hoping for that.
Very good. So if somebody's out in the viewing audience and you happen to be this person, or you might know of someone who might have some property around the Harrison area, they would sure appreciate it. Maybe a donation. They are a 501c3, so your donation is tax deductible. And it is, if you don't think there's a need, just go out to the shelter and you'll see. If you happen to be a true animal lover, take a drive out there if you haven't been out there, and you'll go, wow, I don't know how they're doing all this with the situation they have out there. Let's talk about Trivia Night. Speaking of fundraisers.
Oh, Trivia Night has kind of been my baby last year and this year.
All right.
Not that I haven't had a multitude of help. I don't want to make it sound like that, but they had Trivia Night for the first time 3 years ago, so this is our third annual one.
Okay.
And last year I kind of took over, headed up the planning, I should say, and this year as well, and having such a great time with it. It's coming up October the 11th, so just a couple of weeks from now, and it's at 6:30 in the evening, and this year we're having it at the Quality Inn Convention Center.
Okay.
We were needing just a little bit more room, which is a good problem to have.
Absolutely.
And so we're growing a little bit this year.
Okay. And then how much does it, what's the cost? It's tables are $200?
Yes.
And that's for 10 people?
Yes. So a brief little description of the way it works, because I feel like a lot of people are intimidated by the idea of participating, and they picture it being a little bit like Jeopardy, I think.
Right.
And it's not like that at all. You don't have to stand up in front of anyone. You don't have to press a buzzer when you know the answer. You're not going to get embarrassed.
Right.
It's tables of up to 10 people. It's $200 for one of those tables, and a lot of times it's just local businesses or groups of friends who participate as a team.
Okay.
And you'll have a score sheet. We'll display the questions up on a projection screen with multiple choice answers. So you'll write your answers for each question. There's 10 questions in each round. Someone will come gather up your score sheet, turn it into the scorekeeper.
Okay.
Then we display who won that round. So it's not like you're put on the spot. You're not embarrassed. It's just a question comes up. The group is able to discuss it and choose an answer. And so it's a really fun, friendly, competitive kind of environment. It's really great.
Do they need to sign up ahead of time for this? If you need to know kind of the numbers, don't
it really helps. You can totally show up that night. We would be happy to get you set up and get you placed as a team. If we can know in advance, it's great, because it helps us with a head count and with seating, and also we make like just different little team mascots. We set up team mascots with some of the animals there and different things like that. Some of the longest residents of the shelter. There's dogs that have been there since 2012. And so those are some of the ones we highly promote at Trivia Night, some of the ones that have been there a long time, and really get those dogs known. And so it helps us out a lot to get your team and your setup ready if we can know in advance.
I'm sure they can come by your business anytime and pick up a form or pick up a form.
Yes, you can come by Nature's Wonders, and that's where I can be found. And I've just been giving my cell number because I feel like it's the easiest.
Right.
It's 870-688-2285. I feel like that's just cuts right to the point.
Get to it.
Get to me.
What about at the Cause for Paws?
Yes, the Cause for Paws thrift store could get you, or at the shelter as well. Anyway. Could definitely get you in contact with someone to help you get you signed up, and yes, everything like that.
Sounds like a lot of fun, and obviously the money goes to a great cause because it's going to the Ozark Humane Society and all the efforts that they do to take care of these unwanted animals. And I'm saying unwanted because that's what they're there for, but they need somebody to take care of them that really wants them. So it's very important. If you want to sign up for Trivia Night coming up very quickly, October the 11th, 6:30 p.m. at the Quality Inn Convention Center, get a hold of Michelle or any of those people. Go to the Cause for Paws, and they'll get you. Thank you so much. Good luck. And let's get back together, and we're going to promote this new facility as you get that property. Okay?
Sounds great. I'm looking forward to it.
Thank you, Michelle. Thanks for joining us on Connection. We'll see you again next time.